Hi guys, Dr. Cliff here with HearingLoss.com, and in this video, I'm discussing the link between hearing loss and dementia. Back in 2011, a study was released by Dr. Frank Lin out of Johns Hopkins that identified an increased risk of dementia in individuals with untreated hearing loss. In that study, they identified that individuals with a mild untreated hearing loss were 2 times more likely to develop dementia later in life. That number increased to 3 times more likely if they had a moderate untreated hearing loss, and 5 times more likely if they had a severe untreated hearing loss. Since that time, there has been a lot of talk about this apparent link between hearing loss, dementia, and cognitive decline. And the jury is still out as to whether treating hearing loss will reduce your risk as you continue to get older. In a 2015 study that was conducted over a 25-year period, researchers identified that self-reported hearing loss is associated with accelerated cognitive decline in older adults, and that hearing aid use reduces this decline. Additionally, in 2020, the Lancet Commission identified that hearing loss in midlife was the leading potentially modifiable risk factor for dementia later in life at 8% of total risk factors. Now, I want to be clear when I say this. There is no guarantee that if you treat your hearing loss that you will prevent cognitive decline and dementia. There is also no guarantee that you will experience cognitive decline or dementia if you do not treat your hearing loss. However, based on all information that we currently have from dozens of peer-reviewed research studies over the past decade, the best recommendation is that if you have a hearing loss, you should be treating your hearing loss. Whether that's with a surgical procedure, hearing aids, a cochlear implant, or an auditory brainstem implant. Even if research eventually identifies that hearing loss does not cause dementia, there are no negatives to treating your hearing loss when it comes to the improvement in your quality of life. So do yourself a favor. If you are over the age of 50, you should receive a baseline hearing test whether or not you perceive any hearing difficulty. If you do experience hearing difficulty, it is in your best interest to receive a hearing test and learn about your treatment options. Alright guys, I hope you enjoyed this video. If you did, please hit that like button and make sure that you subscribe to the HearingLoss.com YouTube channel for more content. And I'll see you in the next video.